So, day everyone, my report is all about Entamoeba histolytica, its characteristic, life cycle, disease and diagnosis, symptoms and treatment, prevention and control. So, Entamoeba histolytica is a pseudopod-forming non-flagellate protozoan parasite that can cause proteolysis and tissue lysis. So, it is a member of the phylum Sarcomastigophora and subphylum Sarcodina, class of Lobosa, order of Amobida, the family of Entamoebidae. So it is well organized as pathogenic amoeba. Pathogenic is free-living amoebas that can give a brutal infection to humans associated with intestinal and extraintestinal infection. So, Entamoeba histolytica its life cycle consists of two stages: the amoeboid trophozoite and the infectious cyst form. So, the first one is the cyst, or about 10 to 15 micrometer. It is round, contain to 4 or fewer nuclei, a glycogen, and a ribosomal assemblies called chromatoid bodies, and are surrounded by a chitin wall. So cysts can be killed by heat and freezing temperature and survive only a few months outside. So kasagara gyud kining cyst mo gini ang ma-ingest sa tao maong makakuha siya og Entamoeba histolytica nga parasite. Next is the trophozoite. The invasive trophozoites are about 10 to 60 micrometer in diameter, have a single nucleus with a central karyosome, and are facultative in aerobes and require complex arsenic media for growth. So, kani pong trophozoite, opposite po ni siya sa cyst. Kay once mapas na siya in the stool, so ma-destroyed na dahil ni siya once nga makagawas na siya sa atong lawas. And impossible pud kayo na mabuhi ni siya once nga ma-ingest sa tao kay tungod sa grabe nga exposure sa gastric environment. So the life cycle of Entamoeba histolytica starts with the ingestion of mature cyst from or in fecally contaminated food and water or hands. So dito magsugod na pag ma-ingest na to sa tao, sunod na dayon ang process sa excistation, which occurs here in the small intestine. And once nga ma-release na ang trophozoites, mag-migrate na din siya sa tong large intestine. So, ang next na mahitabo is ang kaning trophozoites nato mag-multiply siya via binary fission, or which ang organism mag-duplicate sa iyang genetic materials and then ma-divide siya into two parts. Muna na niya itong another trophozoites and cyst. So, after that, both of these stages are passed in the feces. So, una siya ang poop sa tao. So, ang disease caused by this parasite is what we call amoebiasis. So, it can affect anyone. Bisan kinsa pwede maapektuhan ani. Although this is more common in people who live in tropical areas with poor sanitary conditions. So, atong mahatag nga example ani is here in the Philippines. We are a tropical area with some mga places here are having a poor sanitary conditions, like those nga nasa urban areas. So in some cases, it invades the colon wall, causing acute dysentery or long-term chronic diarrhea. And the infection can also spread through the bloodstream to the liver. And in rare cases, pwede siya mo spread sa ato ang lungs, pwede pod sa brain, pwede pod sa uban nato nga organs. So diagnosis of Entamoeba histolytica. The most common is this identification of cyst and trophozoites in the stool of a person. So sa poop sa tao. Next is immunodiagnosis, antibody detection. Under anemia is the enzyme immunoassay, which is very useful in patients with extraintestinal disease like amoebic liver abscess. So when this happens when the organism is not found in stool examination. Another one is this indirect hemagglutination. So if antibodies are not detectable in patients with an acute presentation of suspected amoebic liver abscess, second specimen should be drawn 7 to 10 days later, and if the second specimen does not show seroconversions, other tests should be considered. Another one is the antigen detection. So this is very useful as an adjunct to microscopic diagnosis in detecting parasites and to distinguish between pathogenic and non-pathogenic infection. And the last one is the molecular diagnosis. So aning sa molecular diagnosis under niyan is this radiography, ultrasonography, CT scan, the MRI para sa detection sa liver abscess and cerebral amoebiasis. Also this sigmoidoscopy and colonoscopy can provide diagnostic information para sa intestinal amoebiasis. Signs and symptoms includes mild symptoms and severe. Mild symptoms include abdominal cramps, so gasakit ang tiyan, diarrhea, passage to 3 to 8 semi-formed stools per day, or passage of soup stools with mucus and occasional blood, kung gadugo-dugo, fatigue, lantan, excessive gas, sigig utot-utot, rectal pain, sakit ang anus, and unintentional weight or kanang kalitra og ubos imong timbang. Severe symptoms may include abdominal tenderness, bloody stools including passage of stools with strict bloods, passage of thin to sigir kag libang-libang, yanay kauban nga dugo, hilantan ka o sige kag suka-suka. Ang treatment ani depende ra gid siya sa unsa ka severe or mild lang ba ang infection. Usually ang mga antibiotics ang gina-prescribe. So kung if you are vomiting, you may be given medicines through vein until you can take them by mouth. So gina-inject lang gid siya hantod nga pwede na ka makainom ato nga tambal. And medicine to stop diarrhea are usually not prescribed. Nga naman, pwede nila ipa-worse ang imong condition. So after that, after sa antibiotic treatment, your stool will likely to be rechecked. So gina-check na siya utro kung para makita nga wala na gid ang katong infection. Treatment of amoebiasis includes pharmacologic therapy, surgical intervention, and preventive measures as appropriate. So for prevention and control, improve water supply. So use purified drinking water. And for the travelers, to reduce the risk of transmission, use bottled waters. And sanitation. So improved sanitation will help to reduce the likelihood of always wash your hands. Food safety. So washing fruits and vegetables with clean water or by peeling them yourself would help to reduce the transmission of this parasite. And health education. So we have to educate everyone that this disease can be transmitted by just holding anything or putting something on your mouth. And this can be spread through different forms of social medias. Thank you for listening.